I'm only doing this because of the recording. This is great. You guys, you know how to do community work, and the first thing you do is you show up, right? So thanks for being here, and certainly I'm thanking my colleagues. Hold this over here. I think it has to be far away. My colleagues for coming in from out of town and for talking to us today about the Blue Zones projects. And for those of you who don't know, Family and Community Health does a lot of work out in communities around health. And we do community engagement, and we work on different projects, mostly around nutrition and physical activity. Right now, working a lot on building healthy, equitable communities. And the Blue Zones project is one way for us to do that. And I have my colleagues who will explain to us what Blue Zones is and how they each got involved in the kinds of things that they're doing in their communities. So first up, Patty Case, who is one of our longer-term faculty members, is an associate professor, a registered dietitian in our program in Klamath County. She collaborates with local organizations to build capacity for healthy eating and active living, and she serves as the co-chair of their Blue Zones Restaurant and Grocery Store Committee, and as a member of Food Policy and Leadership Committees. And Klamath County received one of the very coveted Robert Wood Johnson Culture of Health Awards this year. So yay, Patty and her colleagues. I think there are about 300 communities that apply and 6 to 7 win in any given year. So we're talking extremely competitive. So congratulations. And so I'm going to go next to Lauren Kramer because she's sitting right next to her, who is an assistant professor of practice of ours in Hood River and Wasco counties. She manages the SNAP Ed program, which is our educational program for SNAP recipients. If folks don't remember, that was the food stamp program. In 5 Columbia Gorge counties, she collaborates with numerous community partners to promote health and reduce chronic disease. She's co-chair of their Blue Zone Steering and Sustainability Committee and Food Policy Committee. And guess what? The Columbia Gorge region received an RWJ Culture of Health Award in 2016. I think we may be one of the only states to have 2 winners, so congratulations, Lauren. Mandy Hatfield is an instructor for us in our Extension Family Community Health program in Douglas County. And she manages the SNAP Ed program and serves on Blue Zone School and Food Policy Committees. And then Cheryl Kirk, also a registered dietitian, is a senior instructor for Extension Family Community Health in Jackson and Josephine counties. She manages the SNAP Ed and the FNEP program, which is sort of like SNAP Ed, but it's for a more targeted population. And she collaborates with community partners to promote healthy eating across the local food system. And she's a preceptor, that's the word, for dietetic interns in Southern Oregon. And she serves on their Blue Zones Steering Committee. So please join me in giving a warm welcome to all of our colleagues who've made it all the way here.
Well, thank you and welcome. And this is great because I'm often in the county watching you all in here. So I get to be on this side, which is a really unique position to be in. So I really appreciate the opportunity to share with you lessons from the field. Along with my extension colleagues, I believe we really do bring a unique perspective because we live, work, and play in the communities that we are trying to change. So that's a different perspective. And today, the presentation isn't going to be it's not going to be your typical research presentation where we give you the the facts and figures of the research. It's going to be more presenting a model for working with, in, and for a community and our experiences in doing that and our observations in doing that. So think for a minute. What if I offered to sell you a product that could add 12 quality years to your life? And I'm saying quality years to your life. What if you could gain those 12 years, not just for yourself and your family, but for your whole community? The Blue Zones are geographically defined areas where people live measurably longer lives. I'm sure most of you are familiar with Dan Buettner and the Blue Zones. How many of you have heard Blue Zones? I'm assuming most everybody has heard some rumbling of the Blue Zones. It's been in the popular press, National Geographic, lots of books published related to the Blue Zones project. But Dan Buettner, he's the founder, and his team, they identified 9 common lifestyle factors that are found in these Blue Zone regions throughout the world. From this, the Blue Zones project was conceived. And this project is an environmental change model, and it's designed to influence systems and policies in targeted sectors of a community. Think about the sectors in your community, the grocery stores, the businesses, the workplaces, the faith-based and civic organizations, the schools. So it's very similar to other models you might have come across and work with all the time. Think about social ecological model or the health impact pyramid, very similar to that. This model, called the Blue Zones Project, has been launched in communities throughout the nation. Over 50 communities in 8 states since 2010. Klamath Falls was the first demonstration community in Oregon in 2015. And in 2017 was joined by 3 other communities, Grants Pass, the Dalles, and the Umpqua region. So this presentation, I'll provide an overview of the principles and the framework of the Blue Zones. So for those of you that have some familiarity, it'll be a bit of a review, but those that you don't, it'll be like, I understand this model a little bit clearer. We'll talk a little bit about the metrics that are used in evaluating the Blue Zone project. In our community, we've had it for 3 years, so we have some data that we're starting to collect from that, and I'll share that with you. And then we want to share with you some of the successes and challenges from my extension faculty and from myself, and how we are going about really trying to impact the culture of health in a community. So what is Blue Zones? Does this look familiar to any of you that have read Blue Zones? Right. As I said earlier, Blue Zones are regions with a higher concentration of people that live to over 100. And not just live, they're living quality lives. They're living lives where they're still contributing to their community. And many without chronic diseases. Life expectancy of Americans born today, you probably know, is about 78 years. So why are some people living to 100? And not just living, like I said, but living productive lives. Why is that? That's the question that Dan Buettner was faced with. You're probably also familiar with the Danish twin study that suggested that only 20% of how long we live is determined by our genes. So he looked at that information and he questioned that. And so he went out to search across the world to find where there were pockets of people living over 100 years and asked that question. What is it about in these communities? What is it about the individuals? What is it about the environment they live in, their culture, that allows them to live longer and better? And so there was originally these five places or pockets: Sardinia, Greece, Costa Rica, Loma Linda, Japan. Can you kind of picture those places a little bit, those of you who are familiar with that, and what might be some characteristics of those communities that would allow them to live longer? This is the thing he went out to examine with his research team. The story is that once they found these pockets and they identified where most people lived over 100, they circled it with a blue pen. That's the Blue Zones. A little trivia for you there. So Dan Buettner's team, his research team, they identified these common denominators. There were in all of these communities that had these high numbers of people over 100 years. In these communities, people were living 10, 12 more years. And they're called the Power of 9. These are going to resonate with you. If you haven't seen these before, they'll resonate with you. It's like, well, yeah, that makes for a healthy community. When I looked at these, I'm used to looking at food, nutrition, and physical activity. But these really have a broad wellness, health aspect to them, which to me, I think is one of the things I really got out of the Blue Zones Project is when we talk about wellness and well-being, it's very broad and it's very intertwined. So no news to you, but from a standpoint of somebody that really focuses on area, this helped me look broader at wellness and health in much larger terms. So the 9, we'll go to, oh, excuse me, I didn't want to go that. We'll go through the 9, the power of 9 here. And again, they'll probably resonate with you. Move naturally. And what they found in the communities that they examined is it wasn't that you went to the gym or that you did a marathon, but that it was incorporated into their lifestyle. They did gardening and they moved their bodies to accomplish tasks. Another one is purpose, having a purpose. They have different names for it in different cultures, but it's basically why do you get up in the morning and having a purpose in doing that. Downshifting. It's not the absence of stress. These communities had stress. It was not the absence. It was how the stress was managed, and they had tools for managing that stress. Whether that was prayer or meditation, maybe it was a happy hour, but it was something to manage stress. The 80% rule, that refers to, I don't think we have that too much in America. Ours is the 150% rule, like eat more. But this is about 80%, that you have this cultural perspective that you're going to eat not until you're full. You're going to eat 80%. And that means that you're probably eating your main meal towards the end of the day, and it's a smaller meal. And then plant slant. It probably doesn't surprise you, but that focus on plants. Most of the communities had one of their staples were legumes or beans, and so they would eat meat maybe once a week, right? So it wasn't an everyday thing. So the focus on plants. And then the wine at 5. This is drinking in moderation and drinking on a regular basis. This isn't saving up all your alcohol to Friday night or Saturday night. This is, that's just part of the culture. You drink some wine. And in some of the communities we are working with, that doesn't quite resonate. And so the emphasis is more on friends at 5 or winding down at 5. So that emphasis of that you're not drinking alone or you're not being alone, but you're with others and winding down together. The other aspect is belonging to a faith-based community. It's really interesting that in almost all of the communities, except for 5 that they looked at, or all the people that they looked at that lived over 100, all of them had some, didn't matter their denomination, but they had some consistent faith-based place that they went and participated in. Another one is having loved ones in your life, having a committed life partner, putting kids first, taking care of grandparents, that nuclear family, so to speak. And then the last one is having the right tribe. If you can't pick your genes, then pick the right tribe, because we know that definitely influences your health. So research from the certainly has shown that smoking, obesity, happiness, and even loneliness are contagious. And so picking the right people that will support your health habits is important. So those were the commonalities they found. And now, how do you apply this to a community? In taking it out of the areas where the people were over 100 years old, how do you apply that to different communities? And that's what the Blue Zones Project is. And it uses a model of lifestyle radius. Have any of you heard of this, or is this? Some of you are shaking your heads. What's lifestyle radius? It's based on the research that most of the choices we make are within 5 miles of where we live and work and spend our time. So if we can influence changes, whether that's policies or whether that's gentle nudges or whether that's defaults, if we can do that at school, at work, and at the restaurants, at the grocery stores, if we can make those nudges, either generally they're not really conscious choices you're making, it's just the default you do, that we can influence the health of a community, of course with the underlayer of the policy and environmental influence. So I'm just going to read you a little scenario to kind of bring this home that incorporates some of those aspects. If you were living in a 5-mile radius, what you might experience and how those nudges might happen. So let's see, I go to work, and actually I heard somebody say this when they came in here. Pamela said that, I always walk. I don't know what it is, quarter mile. She has to walk quarter mile to get to work. So let's say I have to work. I have to work. Yes, I have to work. But I'm going to walk to work because my parking space is free. So I have to walk a quarter mile to get to work. Okay, I do that because it's free because I want to save some money. And when I get to work, I would really like a donut. But darn it, they only serve yogurt and fruit at the meeting. Okay, I'll have yogurt and fruit. And then my workplace has a flexible work schedule. Isn't that nice? All right, so I can go to my son's, he's having a birthday at school, so I'm going to leave school and go and take my time to have lunch with him. I don't stop at the store and get any cupcakes because at school they don't celebrate with cupcakes. They celebrate at lunch, and the table is all together with the kids that have a birthday of the month, and we sit down together and we share, we talk about, we have some pencils and erasers, and we have a meal together. And my son, surprisingly, eats his whole meal, the healthy meal that's served at the cafeteria, because he's had recess first. Later, when I go to pick him up after school, we go for a walk, and we go on a path that is connected from my house to the playground. When we get to the playground, there's a dog park there, and there's lots of people, so we feel pretty safe. And then we decide to hang out because nobody can smoke in the park, and nobody's blowing smoke in our face, so we just really enjoy. We're hanging out with our friends there. It's a nice social time for us. And then after that, as we leave, my son says, well, it's my birthday. Can't we stop and get a little snack? I'm hungry. Well, yeah, let's stop at the store and get that. And we choose to go through the healthy checkout line where there's no junk food, so we end up getting, I shouldn't say junk food, but higher calorie food. And then and we get some water and fruit instead, because that's what's in the healthy checkout line. And we wouldn't want to buy the soda anyways because it's taxed. So you kind of see, so you just kind of see that picture, those nudges and those prompts, and that's really what Blue Zone's trying to do, is create those gentle reminders, those gentle nudges, those defaults, those policies that support healthy choices. And you've heard that term, making the healthy choice the easy choice. So what in a community does the Blue Zone project look like? What does it look like? Well, ultimately, our goal is to get certified. That's right where we are in Klamath Falls. We're at our 3-year mark. We're looking to get certified. It means going to a lot of meetings. It means doing a lot of ribbon cutting. There's a great fanfare and a lot of media around that. Can you imagine why we would want that? It is the idea of creating awareness and creating, wow, another business got Blue Zones. We must be a healthy community, right? So that's a big part of feeling healthy, is that you live in a healthy community. So yes, there's a lot of accelerated change that happens, a lot more meetings that are happening, a lot more synergy and energy that's happening. But the ultimate goal is to get certified in 3 years, and I'll share with you how we go about doing that. So I'm going to just give you a brief rundown of what happens over those 3 years. This will look very familiar to anyone that's done any type of community-based efforts, but you always start with assessing the need and determining if the community is ready. Then you're moving towards forming a steering committee and other committees. Love those committees. And then creating an action plan. They call them in the Blue Zone project a blueprint. So for the grocery stores, for the schools, for the workplaces, they each have their own blueprint, their own action plan, and a team that's working behind them. And then a steering committee that's overseeing the progress. Establishing metrics. Sometimes when we do community-based work, we leave this part out, right? We want this, but we don't have the money or the time to really measure the outcomes or the results. So an important part of the Blue Zones is that. And then we get pledges from all the sectors and get their commitment and their buy-in. And then once they have achieved their Blue Zone recognition, we as a community can seek total Blue Zone certification. look familiar to other ones that have done community interventions? A lot of the work happens in, you've heard me mention these sectors, and a lot of the work, this is really the heart of the work that happens in the Blue Zones project that are within these different sectors. We have the workplace sector, we have schools, restaurants, grocery stores, faith-based, and other organizations. And we can't forget this important, this community policy aspect too, which is a big part of it. So you heard that each of us were on co-chairs or co-leaders on one or more of these committees, and that's where a lot of the work is happening, and the metrics are being measured, but also the action plans are being set. So let me give you kind of an example, and I had a handout for you because I found this particular aspect very important about the Blue Zone project. I know I don't have enough handouts for everybody, so I definitely have this in electronic version if anybody wants to have it. But it is the pledge form. So based on what school or what sector you're working in, for example, the schools, the Blue Zones organizers would say that you need to meet, I'm just going to throw this number out here, 25 of the possible 30 strategies for you to be Blue Zone approved. And so they have all these best practices that are set up that you don't have to, you do them all, you can pick and choose, but you have to meet a certain number, and then you would qualify as Blue Zone. So it takes a while to get kind of approved, but I shared some examples there for you. So the community policy aspect, I think that most communities have to have 2 or 3 built environment policies that are adopted. Here's an example of in Klamath that what we did was adopt safe routes to schools, a master plan. Another example of the food policy, we did not have a food policy council, and so we established that. Tobacco policy, I think you have to have a couple policies around tobacco use, and we were able to enact the tobacco retail licensing. And then with each sector, again, there's a series of best practices or strategies that that sector can choose. I shared some examples there with you. Faith-based organization might have a number of different things, healthy potlucks, but also maybe a community garden. Worksites, example would be designating a space for employees to downshift. Those are just examples. Restaurants, not putting the salt shaker on the table, always putting water on the table. Those are just some examples of what they might do. Schools, not withholding or using activity as a punishment. Grocery stores, having a healthy checkout line. So just some examples of the best strategies or best practices that might be used there. So you might be wondering, all right, great, you have all these strategies. Well, what's the backbone of this? How do you get this big machine to operate? And I've already mentioned a steering committee, and it isn't just any person that you're going to have on your steering committee. You want those people that have influence, right? So I know in our community they were very intentional in getting the people with influence on the steering committee. So this would be your CEO of the hospital, the person that's your executive director of the CCO, would be your superintendent of the schools, be all of those highly influential people. And you're on the steering committee, so you must be very influential. And then the leadership team is underneath that. They're kind of the worker bees, where they are going to oversee the sector committees, be a co-chair, and then you have committee members. And again, it's they were very good about mapping where the influence was and choosing those people to be on the committee. So it's really cool that we were on all the committees, because that shows that we are intermingled with a lot of activities that happen and efforts that happen in communities. And then, of course, a nice part is there's paid Blue Zone staff. For 3 years, we had 5 paid people. That's where the majority of the money goes, that are going to help run and kind of keep these committees going, and they're going to help measure the metrics and make sure that the paperwork is completed and that the blueprints are all made and keep the machine running. So it's been a huge part to have that. And then, of course, funding. The project itself is not cheap. I believe it's somewhere in the range of $1 to $2 million for 3 years. and that each community has to put up some of that money. 200,000, I'm not sure what you guys had to put up, 300,000, 800,000. So I got off cheap. Helps to be a demonstration community first. So, yeah, so expensive. But it is funded not with any public funds. It is funded with Cambia Health Foundation. That's where the funding is coming from. And then money coming from the communities. So we'll talk some about the metrics, some of what are we trying to measure? How do we know we're having an impact? And so the metrics examine the policies, the number of policies that are changed, and they also examine the number of sectors that are getting Blue Zone approved. This isn't 100%. We have probably 5 grocery stores in our community, and our goal is to get 2 grocery stores Blue Zone approved. We might have 50 restaurants, but we only need to get 15 of those. So this is kind of that tipping point idea that if we get some, the impact is going to be big enough. All right, so it's not 100%. And then we have community-wide measures, and I'll show you some of ours. Every community chooses its own measurements of what they want to see changed. And then the Gallup, I have Healthways, but it's actually not Healthways anymore. It's Share Care WellBeing Index Survey. Here's an example from Klamath of our community-wide measures. And we're still gathering data on these. But of course, we want to get a reduction in obesity, right? But we're not quite sure that's happened yet. There's some thinking right now. We're looking at the numbers, and we think the weight actually went up. But we think that might be just a trend that was outside of a normal, that it's going up, then it's going to go back down. So we're still waiting to see on that one. Reduction in diabetes, still collecting information on that. We have had a decrease in unemployment. And some of you might say, well, how do you know you had that impact? Oh, I don't know. But these are community-wide measures that we're hoping that we influenced. Decrease in prevalence of tobacco use. For me, that's very significant. For us, that's very significant. We have fairly high rates of tobacco use in our community. We have 5% decrease. That's pretty significant. Increase in high school graduation. We have different numbers on that. And then we're not a really high taxing community. But this is pretty significant, is that we did increase our tax base. And that's something that we were looking at. Increase in tourism by 5%. Still haven't had an update on household income. There has been a slight decrease in child abuse victim and removal rates. And then we don't have information yet on active transportation. So that's just to give you an example of some of the community-wide. And does that resonate with you? I mean, is this things that look similar to you that you're looking at as well? So that's just like about 2 years that we're looking at data there. And this is the Gallup Share Care Wellbeing Index. Are you familiar with that? Are you familiar with that? I was only just a little bit familiar with it before the Blue Zone project. But this is really looking at that big picture as to do we have a high well-being? Is this life well lived? And that's what it's trying to assess. Here's a little picture of what it's looking at. We are looking at having a purpose. Do you like what you're doing? And that there's social supports for your life. You have relationships and love in your life. Financial, that you're managing your finances, where you have some for security and that it's not causing you additional stress. Community, that you have a sense of you like where you live and you feel safe where you live and you have pride in where you live. And then the physical is that you have good health and you have energy to do the things you want to do. So I just want to point out that here is where I think, I guess I can be proud of this. Laura's always telling me I should be proud of this. So Klamath Falls since 2015, while the U.S. has gone down in well-being index, we have remained unchanged. And that is true of purpose and social. Everyone has gone up in terms of financial. Our sense of community has not changed there. This has gone up, and the physical has gone down slightly there. So And that's done by a survey response. And that was done 3 years, 2015, 16, and 17. So now, with that, kind of the big picture of what Blue Zone is, how it operates, how it functions, I'm going to have each of my colleagues come up and share with you some of the opportunities they see Blue Zone has presented for them, but also some of the challenges that they see, so you can see that it's not all rainbows and unicorns. There's a lot of meetings.
Handy. Hi, thanks so much for coming this afternoon. It's great to see so many people here. We were joking that we weren't sure if the panel would outnumber the audience, so I appreciate you making that not be the case. So I'm Lauren Kramer, and I get to live, work, learn, and play in the beautiful Columbia River Gorge region, which includes Hood River and Wasco counties on the Oregon side and Klickitat and Skamania counties on the Washington side. We're definitely a region. People utilize services and work and play and do all of the things in each of those 4 counties in that space. So that creates for some really neat opportunities for partnership and collaboration that don't always happen in other parts of the region. But one of the things I think that is really unique about our region, despite a really strong history of working together and collaborating on a number of different things like a regional coordinated care organization or the 4 Rivers Early Learning Hub, a lot of the things where the state gets broken up into regions, our region is always Hood River and Wasco. So one of those great successes, as Roberta mentioned earlier, was receiving the Robert Wood Johnson Culture of Health Prize. And that was a great pat on the back to partners that had been working together for decades. I've been in the Gorge for about 13 years, took 2 years off to come down here for my grad degree, and then went right back because it's such an amazing community. But it also has some different histories and I would say sometimes a darker side that make it really difficult to do true collective impact community health work. So I wanted to share a few of those things to give you a context for why Blue Zones was the thing that we chose to try to help remedy some of those issues. So I made a little list, and I would say that the Gorge is getting better and better at figuring out what are those really impactful cultural or historical traumas that we have to deal with and come to terms with so that we can actually move forward and start improving health. So a couple of things include Japanese internment. We have a really, really strong history of not treating our community members well in the Gorge. Another one is the damming of Celilo Falls. There's now a dam where for 10,000 years people would come and gather and trade among the native and indigenous populations in the region. So that was wiped off the map in the 1950s. We also have a history of being opposed to outsiders coming in, especially young people that are like, yeah, let's do this cool new thing. Because in the 80s, if you've seen Wild Wild Country, some young people came in and said, let's do this cool thing, and it turned out to be the Rajneesh coming in and declaring biological warfare and terrorism in the community. Check out Wild Wild Country on Netflix if you haven't seen it. That's my neck of the woods where I get to work and play. We also have an aluminum plant that closed in the late 90s that up to that point provided 1,500 living wage jobs for low-skilled workers that come right out of high school and have a high-paying job. And so with the loss of that, we've had a number of people fall into poverty overnight. Another issue in the community is that the Union Pacific Railroad cuts right through the heart of our downtown, making active and public transit really difficult, as well as pedestrian and bicycle access. And the railroad is not always a good partner. One of their trains fell over in Mosier recently when it was carrying Bakken crude oil from South Dakota and lit on fire right next to the elementary school, which had to be evacuated. So there's a lot of things that happen in our beautiful Columbia River Gorge that we have to work around and work through to try to address community health. And I would say as a result of all of those things, I forgot one, ICE is currently using Norcor, our local detention facility, to house undocumented immigrants. And so there's just a lot of trauma. So when my program comes in and says, just eat healthy or just be physically active, it kind of feels like we're missing the mark. And I really appreciated the whole whole sense of wellness around blue zones. And I felt like for you all wondering, gosh, you just heard that price tag. Why would you choose blue zones? It seems like, and these are questions our community had to wrestle with. There's lots of other models, whether it was Heal Cities or some of the programs that are developed here on campus. There was a question of, couldn't we do this ourselves? We've got lots of skilled people living and working in the community. Lauren, couldn't you do some of this? And no, not entirely. It's also been something, because of that price tag, we've wondered, are there other or better uses for that funding? And so one of the things I did want to clarify is that the communities are asked to bring in $800,000 over the course of 3 years, but that leverages $2.2 million from the Cambia Health Foundation. And what we're paying for, that $200,000 in year 1 and $300,000 in years 2 and 3, are 4 paid staff that work exclusively on blue zones. And what really struck a chord with me when I was working on the project application was that, probably like a lot of you, I wear 10 or sometimes 20 hats, and it feels like, oh, if I could just focus really intentionally on one project for 3 years, imagine the difference I could make. And so that was one of the key selling points to me, is that we would have 4 whole people, 4 FTE, for 3 whole years working exclusively on making our community better. So that seemed like a really great bargain, actually, for between $200,000 and $300,000 a year to leverage the additional monies that would come in through national expertise, through this really well-coordinated media campaign, all the ribbon cuttings and celebrations. So it seemed like a good buy. I would say some of the other things that we're helping to address through blue zones is that we've got some of the highest rates of childhood obesity in the state. That's something we're trying to tackle because of those former issues I mentioned. We've got among the highest rates of child abuse in the state, some really high use rates of tobacco and alcohol, high blood pressure, and as I mentioned with the railroad, we're not a particularly well-connected community, so it makes it difficult to be active. But I would say that at one of our early meetings, the mayor said, I think blue zones could save this town. And that was a really striking point to me because we've had some real difficulty getting buy-in from some of our elected officials. And I would say the Dalles tends to lean red, and they're a community that doesn't want people telling you how to live or who your friends should be or that you should even go to church or that you should eat plants. We've got some ranchers and wheat farmers and other folks in the community. So in many ways it's been a hard sell, but I think what's exciting to me is that Blue Zones is established in 3 other red-leaning communities. And I feel like if we can use those places as laboratories for testing out health policy and testing out community wellness initiatives, then what a neat springboard to launch other projects in other parts of the state and in the country, as we're seeing. So I think one of the things I just wanted to touch on is where we've had some success so far. I mentioned built environment. And our Built Environment Committee is awesome. I think one of the things they would say is Blue Zones has helped to get all of the plans that are sitting in binders in people's offices actually into implementation stage, which is really great. So every county and city government has binders full of plans somewhere, and ours were just kind of sitting there. And so Blue Zones, through their staff and through the coordination, have been able to get things like safe routes to school actually happening. So this is a picture you can see. Our Dry Hollow Elementary School had this awful configuration of cars dropping kids off because there's not safe sidewalks for kids to walk. So parents are driving kids in, they're nearly hitting the few kids that are walking to school. There's conflict with buses. So we set up a model system just using temporary cones and fencing, and that is something that with some upcoming funding through Oregon Department of Education and Oregon, the people that provide funding for roads, my mind just went blank. What is it? ODOT. Yeah, so many acronyms, you forget some sometimes. So ODOT and ODE are partnering with schools to do some grants for safe routes to school. And because the schools in the Dalles are all Title IX schools, they'll be eligible for that first round of funding. One of the other ones is connecting some bike and pedestrian corridors through town that currently don't connect. It sort of stops and ends or goes right into gravel. So that's a big thing that we're hoping to get out of a binder and into actual real life. And another one is a riverfront trail and Mill Creek Greenway, really trying to get people along the waterfront where it is a more beautiful spot of town. I would say some of the challenges and pushback, in addition to a few that I mentioned before, is what are we going to do to increase or include sustainability in our planning? You can see some nodding. And I think that's a really, really important question. And in our region, one of the things that we wanted to plan for was sustainability. So we've titled our steering committee the Steering and Sustainability Committee. Our goal eventually is that blue zones will have a ripple effect out into the other gorge communities, so the whole gorge will be a blue zone. We determined that the Dalles is of greatest need currently, but our hope is that Hood River and White Salmon and Bingen and Goldendale and Duffer will all start to glean from the lessons and things that we've been able to implement in the Dalles. One of the other things is blue zones is often critiqued for being sort of an upper middle income campaign, and sure, you can do a walking moai if you have the time and can do your Healthy Blue Zones potluck if you know how to cook and have access to healthy foods. And so we've really pushed to have a strong equity lens throughout the process, and that's included hiring bicultural and bilingual staff. It means that everything that Blue Zones puts out is also translated into Spanish, because we've got between a third of our adults and up to 50% of our youth who are Latino, and so we want to make sure the program's accessible to them. And then we're also piloting some work, that's the second picture up there, with our local food pantries to bring the Blue Zones project to them, because we know not all of our community members are able to go to restaurants, which is an existing sector. So we're hoping to have the food pantries adopt some similar policies and things like that. And I think the other thing for sustainability, when I was doing my little Blue Zones road shows trying to build up support for this, is that when we have policy behind some of the changes that are made, it's a lot harder to go back to things, right? No one is ever raising their hand like, we should smoke on planes again. That was a really cool time. So I feel like if we get all of the work sites to have standing desks, or to have flexible time, or to get rid of the donuts, or whatever it might be for those work sites or sectors, no one's going to be like, I really liked my old seated desk. I'd like to go back to that. So I feel like there are some really wonderful things that are built in through the policies that after the 3 years or the 6 years, there would be some real positive change that has occurred, and there wouldn't be that ease of transitioning or sliding back into the way things used to be. I think that's all I have for right now. So I'll pass it off to Mandy, who's going to speak next, and then I know we've got time for questions.
Thank you. Nope, I should probably let you out, huh? All right. Hi, my name's Mandy Hatfield. I'm in Douglas County. And I'm going to have to ditto a lot of what Lauren said, because I grew up and lived in Douglas County, came up to Corvallis, lived here for probably 6-7 years, and then moved back. And we have similar smoking rates, probably where we're some of the highest in the state. We're a very large community. And we've had issues with our community as a whole, because we are so large and spread out, working on similar things, so that we're all using our what we're doing and moving in the same direction. And so I've really enjoyed this Blue Zone process, because they've brought the community members together and had us collectively decide what we wanted to work on for our community. So for the first time, I feel like we all are on the same page, working on the same objectives, the same goals, and it's really helped align as a community. We are such a large county. We originally, when we applied for Blue Zones, applied for the whole community, or the whole county, and Blue Zones is like, oh, you guys are just too big for us to focus on that. So we had to pare down to the Umpqua. So we picked 3 zip codes with the majority of our population. I am doing work in the food policy area, and then the school sector committee. And where I came into the school sector is I mostly do SNAP Ed work. We work with usually at least 10 elementary schools each year, and a variety of middle schools doing nutrition education programming. We also have a lot of great resources within Extension that, thank goodness, our Blue Zones partners have decided to adopt what we've already created. They're like, you have great stuff through Extension. It's already created. We don't have to redevelop it. And then you're going to be here when we leave. And so they have really been great to work with, because they see the benefit in Extension and what we already have created, and that we can help be a sustaining piece within the school sector portion of it. This is a picture of the fanfare that they get when a school becomes Blue Zones approved. And schools have to pick a variety of things. And so for this school, they chose to adopt Extension's Healthy Celebration. So they're our first school in our area to do celebrations just once a month. They have decided to not have recess taken away as punishment. They have started recess before lunch, so the principal actually rewrote the whole schedule at the very beginning of the year, so all students got recess before lunch. So we've had she's implemented putting in water bottle refill stations in her school. She's been working on the safe routes to school so kids can safely walk and bike to school, which is something that is a very large issue in that particular community, how to get kids there. So they've chose to adopt all of these strategies. They're our first Blue Zone approved school, and they are helping us get into the rest of the district. So some of the things that we're doing there, she's our leader in showing how effective it is, and hopefully we're planning on some of these being adopted throughout the whole district, which is 8 elementary schools, 2 middle schools, and one of the largest high schools in the state. We have been working with the cafeterias to do food waste studies and smarter lunchroom assessments. From that, we actually are working with the district food service director to make changes at the district level as well. So most of what we're doing, even though we're starting with just a couple schools, we're implementing through the district and hope that the district on the healthy celebrations, it sounds like they're thinking about adopting it. And it's one of those things where just like the city, they have all these lovely policies written, and they're sitting on a shelf, and none of the principals actually even knew about them. So bringing awareness to these policies and then helping them figure out which ones they're going to pinpoint and how they're going to work towards doing that. And so thank goodness we had one really great principal that was willing to jump in and try them, because she said she has had lots of pushback from the staff and pushback from her community. And so even in just the first 2 months of implementing healthy celebrations, she said her teaching staff is already seeing a benefit, especially with Halloween. They didn't do candy for Halloween. They did healthy celebrations. And she said this is the first year that they've had no disciplinary issues for Halloween. So I think the staff was equally excited in seeing those results. And so those are some of the successes. Other things we're working on within the school sector is conscious discipline. Blue Zone's paying for staff to go to these trainings, and I'm totally forgetting the name. Oh, restorative justice as well. And so we're helping to create plans for the schools to adopt those policies, and the metrics we're using is to look at chronic absenteeism to see if we can reduce that by implementing some of those strategies. We're creating the safer routes to school, walk and bike to school stuff, and then helping the school meet their physical activity. They had no PE teachers in the schools. They had teachers teaching them when we first started, and so they have brought back some PE teachers, but not to the level that is needed to meet the 150 minutes. So we're working with schools to do the BIPA 2.0 training so teachers can help contribute, and then also trying to figure out strategies at the district level on how they can meet those. So those are kind of the areas that we're working on within the school sector specifically. So, and I do have to say, it is a very fast paced thing. I would say that was one of the hardest things is, I mean, you have a lot of things that you have to meet by certain deadlines to do all of this in a district level in 3 years. And then there's so much of the readiness stage and just making them aware of why these principles are good, and then how are you going to implement it, and how are you going to work with all this pushback? Are you going to lose staff? I know that's one of the things the principal even said. If I'm requiring it and the other principals in the district aren't, how many teachers am I going to lose? So how can we do this at a district-wide so that they feel really supported by the district and everyone in making these healthier changes that, as a principal, knew were the way to go, but not all of them feel that way. So it's been a great process, and I feel like it is making some really great changes that we think will last. So I'm going to turn this over to Cheryl. Maybe. There we go.
Thanks, Mandy.
Yeah.
Hello? Can all hear me out there? Yes. Okay. Oh, slide.
Oh, I'm sorry.
Okay. My name's Cheryl Kirk, and I am from Jackson-Josephine County. I live in Grants Pass. I've been there for about 21 years now. And it's not that I'm so important that I'm on the steering committee, but we had a community-based committee that had been granted some money through our CCO. And we started looking at what could we do with this money, and then Blue Zones started happening in Klamath Falls, and some of our committee members said maybe we should look at that. So I kind of evolved onto that steering committee. Some of the things happening in Grants Pass are similar to what you've heard through the other communities. I put this slide up here to show the work sites that have been approved as Blue Zones approved work sites here. And many of these represent people who are on our steering committee. So we do have a lot of the key leaders from healthcare and from our CCOs and our school districts. So these have all been approved. And what we've seen in our community is there's been a real ripple effect from that. So in some of the implementation of things like October, we did walking school bus, which you can see happening here. Our community is not a very walkable community. Most of our schools, children take a bus. Their parents drop them off. There's a massive drop-off pickup line that's just a mess. But in the month of October, they conducted 22 walking school bus activities at 5 elementary schools. They had 500 children walk to school during the course of that month, and incorporated 75 teachers, 100 parents, and 50 volunteers. And the thing that was really nice about this is the volunteers were coming from these work sites. So we're starting to see an overlay of what's happening across sectors. So, for instance, one of the people I know that works for a CCO, she stood up in our steering committee meeting last week and said, "Wow, I've been walking to school with kids, and this is the greatest thing to start my day." So it's not just impacting those children, it's impacting the people who are volunteering and working with that program. We've also applied for Safe Routes to School funding for one school, and this has happened through a retired kindergarten teacher who wants to see the school she worked at become a place where children walk to school more often. Challenges, what are we seeing? We have our district, our Grants Pass School District is a certified work site. So we're working on that level that Mandy's talking about now, trying to get schools certified as Blue Zone schools. But we're still encountering things like last week, a donut party as a reward for the jogathon. So we have to get over those sorts of things. And, they call us and want us to bring our OSU blender bike. Well, we'll bring the blender bike, but maybe we look in that booklet and we see what else can we be doing besides just coming to an event and doing something cool. What can we do to help nudge closer to meeting some of those guidelines? And then the other thing, you can see these work sites are ranked. So when Blue Zones comes in and they target looking at some of the highest employers, the key work sites. Things you don't see on there are some of our light manufacturing work sites. We don't have our county in there. We need to get support from our county and also our community college. So those are some of the key work sites that we would like to see on board. And then, like you've heard, the theme with all of our communities is, we live in places where we've had a boom and bust economy. We've had mining, we've had forestry. In our area right now, Grants Pass was one of the second fastest growing economies in the last couple of years. What do you think that was due to? Wine? Marijuana. Okay. Okay, so, and we're definitely seeing, a boom and a bust cycle happening with marijuana. Lots of those folks are moving towards hemp. So what can we do, and what are some of the things we can be doing to create more livable communities, places where people can make a decent living, and where maybe they want to come back from college and raise their children? So those are some of the things that we may see happening with these processes. And quickly, we did a double up food bucks intervention this year from, let's see, the 1st of July through the end of October. And we increased the SNAP use at the farmers market by 17%. And we are working on some policy to try and find funding for double up SNAP bucks across the state. So we've written a policy for that, or a legislative proposal for that. We also have a food policy council that's getting underway starting next week. Retail, restaurant sectors have been a little bit slow to go, and that's one area we're hoping to build on. We have, in our community, we don't have locally owned grocery stores for the most part. We have Fred Meyer, we have Winco, and it's a little bit more difficult to work with some of those big players. And like you've seen, this is really follows a collective impact model, and we're working to try and make these communities more vital and places where our children want to come back and live. Patty has one more wrap-up.
So this is Klamath Falls. I won't talk, since we don't have a whole lot of time here, about some of the things I'm really excited about. You saw the overarching issues that we were making improvements on, but very excited about increased access to healthy foods through a number of different opportunities that we have in our community. And we're 3 years in, so how are we going to maintain the momentum? How are we going to keep it going has been the question for me. So to wrap up, I've been doing this work in communities a long time. And this is a great way to feel energized and synergized about our efforts to change culture. There were many times that I didn't think we were, 12 years ago, I didn't think we were just spitting in the wind. How are we ever going to make a difference? And I do remember one of the doctors on our committee, Dr. Machado, said, "We just got to change the culture." I'm like, what? But look, 2018, I really feel like we're shifting the culture. It's not fast, it's not linear, but it is doable. And I do believe that Extension has a very important role in that, and I believe OSU does as well. So, how much time do we have? Is there time for questions, or does anybody need to leave?
You have to leave. Those who want to ask questions, you can stay. I know people either have to teach or attend classes.
Yes.
Okay, so, excuse me, I have a question for really anybody who has any insight. I was thinking that this is remarkable. It's been really informative for me today, but would this be a program, you think, or maybe somebody's even doing it, that would be applicable to communities of color and vulnerable populations within these large urban areas, because they're suffering from many of the same challenges that some of these rural communities.
So I'll just repeat the question. So would this model work in communities of color and urban areas? Is that the question? Do you want to answer?
I think any of the sector tools would be great to use in those communities, whether it was a community church serving individuals or a local corner store, grocery store. I think there's a lot of the tools that can be kind of pulled from the full community campaign and used just at individual sites or sectors. And I know they've talked about doing that.
Because food deserts are what you always hear about the urban areas, which
right.
Some of the rural areas. I'm not saying your communities, but some of the areas do.
Rather.
Oh, I just said within the 5 miles.
Interestingly, I think Blue Zones is a lot in rural areas. So I believe that has to do with its ability to maybe work quicker, maybe. I think it can happen in urban areas, but we have strong partnerships in small communities because you have to do that to survive. So I think that might be part of it. There's maybe a little bit more readiness to move forward, maybe a little less of the red tape that follows it. We on the Gallup poll, they did look at where the message was resonating the most with. It was resonating across race and ethnicity. The more engaged sectors were women, higher income, educated. Makes sense. Other questions? Yes, Mary.
So, what I appreciate the most about the presentation, and thank you all for coming and doing that today and for your efforts, is that it sounds to me like what Blue Zones has been able to do for you all is inspire you or motivate you or sort of like create an energy that perhaps there wasn't before. So I'm going to rain on the parade for half of a second by saying, we're also kind of promoting their image and their brand, and they're a for-profit. So when I look at that, I think, okay, well, so maybe this kicks in and this works for 3 or 5 years. Is there a mechanism whereby we could establish it otherwise? Do you know what I'm saying? It's like,
I think everybody's kind of shaking their head. The Blue Zones is for profit, and it is making money, and it is a business model. So it's very different than what we would have typically, like you had said. Why don't you do this? And we've tried to do that, but just not at this scale. So I think it'd be great if there was an alternative model that we came up with that was our own, that we could then have that happen. But it does take money to do that and to get everybody behind it. So.
That could be funded. People at the university, and then copy them.
But I would tell you that it was hard. It was a little bit hard to swallow. It is when they come in and you're like, okay, where's your evidence? And have you done a model, or have you had a comparison community? Do you know this is where? I mean, it isn't that type of an approach. It's more like there are definitely some premise to what they're doing in terms of best strategies, but it is they're there to make sure their model their model sells. So, but when we're in the communities, you have to make that decision. Am I going to get on board or am I not? Does it have overall value in it and of itself outside of the fact that they're making money on it too? So I don't know.
And I think watching what happens out in Tillamook, watching what happens out in Tillamook County, where they started with the Year of Wellness, and now they're calling it the Tillamook Wellness Project or Wellness Committee. They are doing a similar collective impact strategy to try and work on reducing diabetes and incidence of diabetes. So a little bit more focused, but they have some dedicated staff people that are helping them work in a variety of sectors in this same kind of manner. So we'll see what happens there.
I was just also going to add one final thought to that the depth and reach of their marketing is also fairly unmatched by other public health campaigns that at least we've been able to do locally. So I feel I totally agree, but it's something that we are paying for, that the community gets it. And some of our partners have said, well, you could open Joe's Sandwich Shop or you could open a Subway, and there's the name recognition and pros and cons to each of those. So we definitely wrestle with it. I don't think any of our communities have bought the whole thing, but I think it's something, we absolutely could try to take parts of and recreate.
And I would say, too, that my prediction is there'll be more of this. There'll be more business models coming to our community that are going to change health, and get on board, OSU. Come on, show us something we can do in our communities, because there's money to be made out there. And Share Care, that I went to their training in Florida, or their presentation in Florida, they have some incredible ideas about how they are going to map people's health via mobile apps, and how they're going to pay people to be healthy. And they've got a powerful machine. Let's go.
Just following up on that, could you say a little bit about the link between the Blue Zones project and the RWJF grants? Are they explicitly linked, or do they just happen to both be the same?
So the question was whether Robert Wood Johnson Culture of Health Prize is linked to Blue Zones, and no, it is separate, but definitely for us in Klamath County, it brought us together, and we believed that we could get it. Prior to Blue Zones, I don't think we would even have considered it. We just didn't have the belief.
Can you say a little bit about the metrics that you collect, or is that driven by the RWJ program? Is it part of Blue Zones? Is it independent?
So a question about the metrics and why we choose the metrics we choose, or Blue Zones chooses that, and then the community informs that or helps filter that. It doesn't have anything to do with Robert Wood Johnson. It would have everything to do with the Blue Zones model that they have created and have perfected, so to speak, over the last 10 years in setting up a wide indicator of what they consider health, both at the community level, but then the well-being indicator, so overall wellness, and then changes within the sector.
Well,
I'm going to say thank you to everybody. Thank you very much to my colleagues who came today.